If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, is type 2 diabetes curable or even bearable without medication? Answer by Tracy Shook. Type 2 diabetes would be curable, except for one small detail: cured is not defined for type 2 diabetes. If you, or anyone else cures type 2 diabetes, there is no way to prove that it was cured by definition, or lack of definition. Like many illnesses caused by lack of healthiness, type 2 diabetes is curable, and many patients have been cured. However, because cured is not defined, many medical professionals still claim it is incurable. It is not possible to prove that type 2 diabetes is incurable. Cured is only defined medically for diseases caused by parasites. Type 2 diabetes is not caused by a parasite. The cure for type 2 diabetes is difficult, and from what I have seen, has only been demonstrated on small groups of people, with some success and some failures. There are several people marketing cures for type 2 diabetes, although most do not use the word cure, because cured is not defined. They tend to use words like reversal, remission, etc. If your type 2 diabetes is cured, and you return to the habits that brought you the disease, you will get it again. Many medical professionals will say that it was not actually cured, it was just in remission. That takes us back to the fundamental issue. Cured is not defined for type 2 diabetes. To your health, Tracy. Founder, Healthacing. I am not a doctor. I do not have type 2 diabetes. I am not an authority on which claims of a cure are valid, nor which cures might be better than others. But to be honest, neither is anybody else. Cured is not defined, therefore it is not possible to study which technique cures better. Good luck. Answer by Tiny Nair. Type 2 diabetes, the common one, results from peripheral resistance of insulin action coupled with destruction of beta cells of the pancreas. Till recently, the only way to cure diabetes was thought to be pancreatic transplantation, but now suddenly new data have emerged. Perspectives have changed. Despite the fact that pancreas is the focus in diabetes, there are three more important players: the liver, the muscle mass and the fat, adipose tissue. Pick Google. The increase in blood sugar results from the increase in glucose output from the liver, while the muscle and fat refuse to accept and take it up. Cure, remission of diabetes is defined as HbA1c remaining less than 6.5 for 2 months in the absence of diabetic medications. The direct trial, published recently in Lancet, show that people who continued to take a low-calorie diet, less than 850 kcal/day, had a 46% chance of diabetes remission compared to 4% in the control group. Ref. http://www.thelancet.com/journal. You might say that what is so great about it? An obese man losing weight might get a better control of diabetes transiently, but this is different. The sustained glycemic control as long as low-calorie diet was maintained, showing that there are more complex mechanisms involving fat metabolism. It is hypothesized that there is upregulation of some genes, ZFP516, which can convert white adipocytes, fat cells, to brown ones and change the whole metabolic milieu. Studies have shown that there is total change of metabolic activation on restriction of calorie, including reduction of triacylglycerol in liver, less fatty liver, and less hepatic glucose output. New research with sonic hedgehog gene, volume responsive anion channels drag, channels that regulate adipocyte size, and the ZFP516 alteration might make it possible for us to take as much as fat as we want and still remain thin. Ref. Hedgehog signaling the ALI2 prevents obesity induced by high-fat diet in adult mice. It seems, calorie restriction has gone from a passive pillion rider to a active racing enthusiast navigating the complex fence of diabetes mellitus. Answer by Wayne Bodolick. T2, type 2 diabetes mellitus, is an hereditary condition wherein the body cells don't respond to the action of insulin. Insulin's function is to transfer glucose from the bloodstream, the body's delivery system, into the cells of the body, which need it for fuel, which allows your lungs to breathe, your heart to beat, your muscles to move, your digestive tract to digest your food, your brain to think, and so on. When the cells resist the action of insulin, your cells don't get the fuel they need, and the glucose levels in the bloodstream get too high, which makes you sick. Initially, to deal with this, the T2's body produces more than normal amounts of insulin, which works for a while. But eventually, it doesn't anymore, as the cellular resistance increases to where the pancreas can't make enough extra insulin. It's then that the patient gets diagnosed. To cure this, the underlying biochemical resistance of the cells of the body would have to be ended, allowing them to respond normally to insulin. Currently, there is no way to do this. There are some meds that improve cellular sensitivity to insulin a tiny bit, but they are maintenance meds, not a cure. You have to keep taking them or the cellular resistance to insulin returns. But T2 can be bearable without meds. For many folks, but not all. The simple fact is that everyone that gets the disease has a different level of insulin resistance, and over time, for most folks, the cellular resistance to insulin increases. It is for this reason that not everyone has success with the two primary tactics for controlling BG, blood glucose, diet and exercise. When docs tell T2s to use diet to control BG, they're referring to the fact that carbohydrates, one of the most common components of our meals, are converted readily and largely into glucose, which the body must utilize or store. Insulin is the mechanism that achieves that. By limiting the amount of carbs in the diet, you can limit the amount of glucose your body has to deal with, meaning you may reduce the insulin need down to a level your body can handle. You learn what that level is with a BG meter, by testing before and after meals. You will learn how many grams of carbs per meal you can tolerate. Limiting carb consumption to that amount will keep your BG in range. Because everyone is different, there's no one that can tell you how many carbs that is for you, but your meter can. Here's a page that outlines the process: test, review, adjust. On exercise, by exercise, we mean any kind of regular physical activity. Physical activity improves cellular sensitivity to insulin, so getting regular, at least 4 or 5 days a week, at least 30 minutes each, exercise helps improve and maintain insulin sensitivity. Active cells are insulin-sensitive cells. Exercise also burns off BG, but that only lasts as long as the exercise session. The improved cellular sensitivity to insulin lasts as long as the regimen is maintained, even if you go a few days at a time without exercise. All T2 oral meds require the use of diet and exercise to be effective. Meds are prescribed when a patient doesn't get the desired results, BG control, with just diet and exercise. But diet and exercise are still required. Many T2s find that as they get their BG under control with diet, exercise, and one or more meds, they can start dropping the meds, and many T2s don't use meds, and still keep their BG under control. But that requires diet, exercise, and a BG meter.